Hi, everybody. My name is Deidre, and I am the Community Health Education Manager here at YWCA South Florida for the Health and Wellness Programs. We welcome you to Wellness Wednesday, where we demystify health conditions that affect minority populations. I'm pleased to have with me today the Obygyn interest group at Dr. Karan Patel College of Allopathic Medicine at Nova University with us today. In this next Wednesday, Wellness Wednesday series, we will continue to discuss the social determinants of health, non-medical factors that can impact a person's health and well-being. And for today's topic, we're going to discuss healthcare access and quality. But before we jump into the questions, I'd like to allow the group to give a little introduction about themselves and what they do at NOVA.
Hi there, my name is McKenna. I'm a M3 at NSUMD. I am the VP of Community Engagement for our OBGYN interest group, and we work to help engage others who are interested in OBGYN in research and community endeavors to help us forward as we go.
Hi, I'm Taylor. I'm a member of the Obygyn interest group at Nova Southeastern. I'm also an M3, and I'm also the president of Student National Medical Association at our school, where we also work to address and help educate people on disparities in health and things of that sort.
Yeah. Hi, everyone. My name is Anne Matthew. I am a second year at Nova Southeastern University, and I am secretary of the Obygyn interest group, and I'm also very involved in a worship community center food bank. So I've been working a lot with the community and helping address topics like health and wellness, which I did as part of a service learning project in medical school. So that was really exciting, and being able to interact directly with the community and learn more about their challenges.
Hi, everyone. My name is Francesca. I am also a second year medical student at Nova Southeastern. I'm a member of the OBGYN interest group at our school. And I also took part in a club that was bridging medical students and law students, and we went into local high schools and taught about social determinants of health in the context of pursuing graduate school careers, so whether that be medicine or law, and we were able to go into the schools and talk with the students.
Thank you guys for joining us. I really appreciate it. So let's jump right into the questions. So starting off, why is access to quality healthcare considered a critical social determinant of health?
So I think with social determinants of health, it's important that we know exactly what they are, right? So it's pretty much any kind of non-medical factor that contributes or impacts someone's health. So it's usually some sort of social or economic condition. So when we talk about access to healthcare or quality healthcare, it's important and it's really critical because it's essentially the first step, right? We can't do anything. We can't begin to talk about improving healthcare if we don't have access to begin with. And when it comes to improving healthcare, the goal is really to help people just live long, happy lives, right? Healthcare improves longevity, improves quality of care. And so that all starts with access. And so a lot of times when we talk about access to healthcare, it's not just physical access, right? Lack of transportation, or maybe places are too far to get to. Those, of course, are difficulties with access, but also we want to think about financial burdens. If it's too expensive, people don't have access. You don't have access if you can't pay for it, right? And that also includes just being unaware of resources as well, lack of education. And so all of these things I think contribute to access. And if we're thinking about improving healthcare, we have to target that first. So that's why access is really, really important when it comes to improving healthcare, quality healthcare for all people.
That's a really, really good point, Taylor. That's one thing here that we do is try to increase women's access to early prevention services. Can you share a specific example of where healthcare access and quality have significantly impacted someone's health outcome?
Sure, I can take this one. So when I was actually in high school, my dad didn't have a job or anything, so we were using like Medicaid services and things like that. And I know a lot of people utilize that, and so the system gets kind of overwhelmed by the amount of people who are using it, which can lead to a lot of like poor healthcare outcomes just because of the volume that of like people that the providers are trying to see and help at the same time. So I went and had my wisdom teeth out, and it was a high volume clinic. Everything went fine with the surgery. And then a couple days later, I started getting a lot of swelling in my face, and I ended up having like a pretty severe infection in my jaw. But I tried to call the clinic to let them know what was happening and try and get some help. And there wasn't a provider that I could speak to. And so I wasn't able to get in touch with someone for about a week. And thankfully, my infection resolved on its own, just like by me doing things. But I eventually was able to go to the clinic, and I was like, hey, like I had this big issue. No one helped me out. No one addressed the problem. And so I know other people have had similar experiences like that just because of the amount of people who are trying to get help. It just kind of overwhelms everything.
Yeah, that's really good, especially talking about the fact that the volume, that definitely makes a difference. If we don't have enough providers, if we don't have enough resources for those providers to take care of the community, then that definitely plays a role. Do you Can any of you tell me, like, what are some major barriers to accessing quality care? I know that we said earlier, we mentioned finance, but are there any others that you guys can name that you might have observed or experienced?
Yeah. So for a while, I was working in a family health clinic that was serving underserved populations and stuff. And a lot of things that people would mention when they would come in is like, oh, I don't have time to come to my appointment. My schedule doesn't like allow me to come, or I can't get time off work because of your hours. They don't coincide. And I'm not willing to take time off work because that's going to limit my access to money and resources and everything like that. A lot of people also talk about how they don't have enough social support necessarily to maybe get a ride to the doctor, or they don't know how to find the resources that could help them get a ride to the doctor, because there are services that exist like that, but a lot of people just aren't aware of them. And then a lot of people in the first place, they come in after years of not having a primary care doctor. So they have like all these conditions that they aren't aware of, and they've kind of spiraled into something bigger than they would have been if they had been able to see someone at the beginning. And then there's also the new issue in Florida of like, there's a lot of healthcare laws that are going around that are kind of limiting, in particular, women's access to different types of healthcare that could potentially be life-saving, or just kind of help them make their own decision in what's happening with their care.
That's really, really good. And that's something that we here at the YWCA have been promoting for the community, just to get informed about your local policies and laws, because that affects our health. Could any of you tell me, like, how do socioeconomic factors influence someone's health access and quality?
Absolutely, I can take that one. So first, we want to just define what some of those socioeconomic factors could be. So one of them could be income. We could have education, employment status, and then your neighborhood environment. So all of those things can very much impact your access to and the quality of healthcare that you can receive. So for example, individuals that may have higher incomes are more likely to be able to afford health insurance, as we were talking about before, pay for out-of-pocket expenses, and have access to better quality care. Also, in terms of health literacy, your level of education impacts your level of health literacy. And so people who have a higher level of health literacy are better able to navigate the healthcare system and make informed decisions based on, on their health. Also, your employment can sometimes provide health insurance through an employer, but a lower paying or part-time job might lack a benefit like that. And then if you live in an area that has limited transportation, as we were talking about before, you might also have limited access to healthcare. And specialists, especially, primary care maybe, but specialties might be harder to get access to. And then also preventive services, which I think we'll get into a bit later, but those can all lead to further disparities in health outcomes.
Yeah, that's really good. Thinking of living in economically disadvantaged place areas, like even thinking about like food, right? Because that affects our health. So like food deserts, those areas like that is what I started to think about when you said that. So that's really good. I wanted to ask you guys, what role does geographic location and community resources play in determining someone's health access or quality?
Yeah, I think both of these factors are huge factors in determining how people receive healthcare and the quality of healthcare that they receive. And so the biggest aspect when we're thinking about geographic location is urban versus rural. And one aspect is how many facilities you have. Like, do you have anything close to you? Is it just one facility, multiple facilities? If it's just one facility, obviously there will be high volume, which means you might have to wait longer to get your healthcare. And then in terms of that, how far do you have to travel to get to the facilities that are there? Sometimes it's close to you, but if it's just that one location, especially in a rural setting, that might be really far. And so if you have something emergent, you might not be able to make it in time to address the healthcare that you need. So geographic location plays such a huge role. And that also varies within different regions. Each region will have a different infrastructure and layout that plays a role into how geographic location affects your healthcare access and quality. And then in a unique aspect, the environment that you're living in plays a huge role. The kinds of conditions you might have might vary. For example, if you're living in the north versus the south, you're exposed to different climates, different environments. So your exposure to allergies and the treatments that might be available might be different. And just people's awareness of different options for your treatment might vary. So if you're especially moving around in different locations and you're in an area that might not be well versed with what you have, your access might also change a lot based on that. And then looking more at the community resources, factors like health education, how many people are there to educate you about these resources? Or are there people even equipped and knowledgeable about these aspects to make sure that you understand even just the basic aspects of healthcare, which I'm realizing as working with people like is not present. And then that comes into economic factors. Do you have health insurance? Does that community have the infrastructure and resources for health insurance options? And I know McKenna talked a little bit about that in her past. And that goes into social support and the public health initiatives and just the resources that are available. And that comes into financial aspects aspects, as well as just the people and the education and just the overall aspects of the ability to even conduct all these aspects.
That's really good. And I mean, you really like summed it up. It's really cyclical. Like everything affects your health and how the outcomes that you have. And you mentioned something that was really good that I thought about, and it was the North and South, and how, yeah, there are different climates. You're affected differently. Your health is affected differently in the treatment that you could receive. So even if somebody came from the South and moved to the North, like that also affects their health outcome. I also wanted to ask you guys, can you talk about how race and ethnicity and cultural background affect someone's health and access and quality?
Yeah, I can talk about this a little bit. So I think, especially in our country, in America, right, there are a lot of pre-existing, systemic discrimination, prejudice, and that has kind of forced some groups to be subjected to living in certain areas, geographic locations like we just talked about, and being of poorer socioeconomic statuses that kind of put them in this box and they're almost trapped into having poor access, poor quality of healthcare. And a lot of time when we think of disparities, it's often phrased in terms of, oh, people of lower socioeconomic status, people living in urban areas. But then when we actually dissect what that means, it's mostly all the minorities, right? So it's really minority people who are subjected to just struggling and not really being in control of their own health. And so race, ethnicity, culture, that all has something to do with it in terms of access and quality. And I think also in terms of quality, although we've come a long way, we still have a little bit of a tolerance problem in this country. And I think once people actually realize that it's okay for other people to have other opinions, other beliefs, and although you don't agree with them, you don't have to accept them as your own, but you do have to respect them. And I think once we understand that and learn that as a community and as a population, healthcare and all the other systems will be better off for it. So race, ethnicity, they all play a big, big role.
That's so true. That is so true. Can you guys discuss any systemic issues within the healthcare system that perpetuate inequities in healthcare inequality?
Yeah, I can talk about this one. So I think a lot of us have already talked about the socioeconomic aspect. And I think one of the first things we talked about, I think Taylor mentioned, was if you don't have the economic resources, you can't receive the healthcare. And it can be something as, they have a plan, they have a treatment plan, but you literally cannot afford it. And those inequalities that exist within the healthcare system make it so difficult for patients to receive even basic healthcare. I know even now that some healthcare policies even limit your ability to see a doctor, where a general physical preventative wellness exam might be covered by your insurance. But if you want to talk about something that's going on wrong with you, that's an additional office charge. And if you don't have the resources to even pay for that extra office charge, then you're not getting the care for the actual problems you're having in your life. And you just see a doctor to tell you kind of maybe things you already know or things that you don't really need to be worrying about. So that really plays a huge issue into the access of healthcare for many. And that kind of leads into the infrastructure. Like, do the facilities have the funding to receive the technology, the resources to test for various things, to make sure that there are resources to be able to test or provide the treatments that patients need? And then the availability of providers. Sometimes I've heard many people wait months or sometimes even up to a year to see a doctor for a specialist, especially. So that is a huge issue when there's not enough providers, especially going back to geographic location, when areas that there aren't a numerous number of options for people. And then going back into the systemic inequalities that exist that kind of just differentiate how people can receive care, and then leading into the discrimination and the biases that people have. And then just, if there's limited resources, how do they make that decision? Sometimes it comes into just implicit biases that people have. And then finally, the cultural competency that a lot of these physicians or other healthcare workers might have, if they're not exposed to these cultures or are not well-versed themselves, that's a huge issue. And as many of us probably already know, language barriers are play a huge role in this inequality that exists. And I can see the difference when I see a patient that's able to comfortably talk to their physician in their own language versus when they have a translator. Even though it helps, it's not really bridging that cultural gap. And I think that plays a huge role in access to healthcare and making sure people receive the exact kind of treatment that they need without missing any minor details that could make a huge difference in their treatment plan.
That's so true. And that's specifically here for Florida and Miami. We're such a melting pot. It's so many cultures here and so many people. So definitely. I wanted to ask, as you guys are training and becoming doctors, what are long-term health consequences that you guys have seen of poor access to quality in healthcare?
Yeah, so for example, if someone is suffering from a chronic condition that they may not be able to continue to have treated, that condition could progress without healthcare to intervene. You could also have a delayed diagnosis of a disease if you're not able to get access to care. Especially when we're thinking about high blood pressure, high cholesterol. These are things that have a lot to do with early management. And there are a lot of ways to to help manage them with your daily lifestyle, with your diet, with your exercise. But again, a lot of those things are not easily accessible to people. And so if you can't get care to kind of address those conditions, they can continue to progress, and then they can lead to further complications, for example, with your heart. Also, if you're not able to access preventive care, you might have a higher risk of developing a health issue. Again, that could have been managed or prevented earlier if it had been intervened earlier. And also, I think another kind of aspect that we might not explore as much right now, but mental health services are very hard to come to have access to. And so anxiety, stress, depression, those might kind of fall to the wayside if it's not prioritized, because it's hard to prioritize that when you have other things that need to be on your plate. And so those mental health conditions could continue to progress as well.
That's true. Mental health is definitely something that it's not new, but we're really trying to bring that to the forefront. I know that we've talked a lot about individual, but now I want to talk about how does inadequate access to healthcare contribute to the overall burden of a community?
Yeah, so it almost goes hand in hand with what Francesco is saying. If you have poor access, the issue is the preventative healthcare part, right? If you have an emergency, you can call 911, go to an urgent care, go to a hospital. But the problem is that without access, there's a big lack in preventative healthcare. And so those conditions like hypertension, diabetes, obesity, they go uncontrolled, and they start from things that can be managed, can be pretty much eliminated, into things that are causing significant decreases in quality of life, morbidity, mortality. And it's just not a good condition for anyone, really. And of course, it causes stress on that individual, but it also causes stress on their family, right? Their community, their neighborhood, and also their community as a whole. You have now everyone in community is sick. You have a decrease in productivity. It snowballs into something that could have been managed, eliminated, into something now that's uncontrollable and now just seems to be a part of your culture, right? Now everyone has hypertension, everyone's sick, everyone's obese, but it could have been prevented simply by having access to that preventative healthcare, or just someone who can help you manage on your own even. Maybe you don't want to see a doctor all the time. That's fine, that's your choice, but at least you have the option and you have the opportunity to go to someone if you need help. But if you don't have that, then who's to say what will happen next?
Can you guys talk about how how can health policies be designed to enhance healthcare access, or what do you guys think are some good ways that it can be designed to enhance it?
Yeah, absolutely. I think definitely a major factor here is continuing to work on increasing the availability of affordable health insurance. Also, there are some movements to invest in primary care. So some medical school programs will kind of fund a medical student's tuition if they will guarantee to go into primary care. And they might do a 3-year program instead of a 4-year program to kind of get them into the workforce earlier, but continuing to kind of focus on encouraging people to move into work in primary care. Also, as we're doing now, addressing social determinants of health in more of a policy aspect, improving access to housing, education, food security. Also increasing the amount of diversity within the healthcare workforce, and implementing telehealth that started to come, about during COVID, but for some people it can be a lot easier to access care either through a phone call or a video if they have access to that, rather than having to travel or take time to try to find an appointment somewhere in person.
Yeah, those are all really good ideas. And we saw the benefit definitely during COVID with the implementing telehealth. So that's really good. I wanted to ask you guys, what do you see as a future trend or change in the landscape of healthcare access and quality of care?
Yeah, so I think we can see in our medical school education a lot of changes happening where we're trying to focus on a more holistic approach where we're not just considering what the facts are, what they're coming in with, and just creating a treatment plan, but what are their socioeconomic factors? What resources do they have available? How can we truly help this patient reach their treatment plan and actually apply it? And consider all these factors that might be different between different patients. So kind of more of a personalized approach to medicine. And then we have more kind of connections that we can see with healthcare systems and the community organizations to help bridge a lot of the gaps that might prevent patients from, having this treatment plan or having a way to improve their health, but then not having the resources or community organizations. And kind of creating those direct relationships helps make that flow and process easier, and then allows it for something to be something they can follow through easier, rather than, oh, okay, now I just have to go figure this out. And that might prevent them from actually doing something to improve their health. And that kind of leads into various policies and initiatives to reduce these health inequalities. Just creating more conversations within the medical education system, between physicians and all the people involved in the healthcare system, to truly make a difference, whether it be kind of at the individual post or at more policy level, and creating a more diverse workforce where people there are physicians and healthcare workers of different backgrounds and different cultures, so that we can really help meet patients' needs as best as we can.
Okay. I wanted to ask you guys, and this is going to be something for each of you, what motivates you to work in the field of healthcare, and how do you think you guys can change it?
Sure, I can go first. So what motivates me is kind of like my own experience, like either witnessing in clinic or like anything that I've experienced on my own. I want everyone to have access to quality healthcare, and I don't think anyone should have to go through anything just because of like their time, their job, or anything of that sort, just because they don't have adequate access. And what I'm hoping to do is, I see all of us hopefully going into like underserved areas and helping other people get that care and that access that they need.
Yeah, I can go next. I think in the past, since high school, I've just been involved in various opportunities where I get to work directly with these underserved populations, whether it be just volunteering in simple ways to kind of help these like free clinics, or just opportunities for them to receive healthcare, or working with health literacy and making more education materials for patients. And I've just really seen how that we can do small things in different areas and make a huge difference. And I want to continue that as a physician, especially as we establish ourselves as leaders in this community, and truly use my position and ability to truly make impact a patient's treatment plan, and work with my colleagues to really help reduce these inequalities, and just continue to help improve health for everyone.
I can go next. So for myself, I'm obviously a Black woman in medicine, right? And there are many who look like me who don't have the same platform and don't have the opportunity to voice their opinions in the way that I do. And so for me, I kind of feel like it's a responsibility, right? Because I've seen how poor access, poor healthcare affects people around me, my own community, and others. Just, from personal experience, also from just volunteering in churches, you can see what poor access to healthcare does to people. And I feel like I have a voice, whereas a lot of others have been kind of silenced. And so if I can be that person, I will always do that and always be that.
And following that, I recognize the privilege that I walk with every day and want to channel that into being an advocate for my future patients. I've worked as a Spanish medical interpreter and have seen how that language barrier can really lead to poor quality care. I also worked with the Nancy J. Cotterman Center here in Broward County, which is Broward County's only sexual assault advocacy group, and saw how community organizations and programs can make a huge impact on the members of that community. And I want to continue kind of utilizing those, kind of creating those partnerships, forging those relationships with members of the community as I go through my training and my career.
Thank you. You guys are amazing, and I definitely believe that you guys make a difference in the future of healthcare. And then my last question, and this is for everybody as well, what, as future providers, what message would you like to convey to policymakers and the public about the importance of improving the healthcare access and quality and their own healthcare or health?
Sure. So I think when we're talking about healthcare policy, especially for the policymakers, something we all need to kind of acknowledge is that everyone deserves a right to healthcare and quality healthcare. And for the policymakers, like as you're going forward, I would suggest maybe as you're making these healthcare policies, think about those people that are going to be affected by these policy as your family or your friends. And how would you feel if your like your husband, your wife, whatever, your best friend was going through something and they needed access to something and they weren't able to get it just because of a policy? How would you feel about that? Or like if you needed access to resources, how would you feel if that was to impact you personally, and then take that and move forward with that policy?
Yeah, kind of building off of that, I think just really working to see everyone as equals. I think we need to really start to remove our biases and try to be more aware of it. In our school, we try to do these assessments and really try to evaluate ourselves consistently to see in what ways are we having these implicit biases, and how is that affecting our ability to provide healthcare for future patients. And I think as policymakers, that's so important to help guide decisions that are really truly working for the best of everyone, and not just favoring certain people and what their opinions are, what they want and prefer. and just really being more aware and understanding and advocating for these various groups. And kind of like McKenna said, just treat them as people that you truly care about and view the policies in that way, and try to really transform the healthcare system, and just really try to make it as equal as possible for everyone, because at the end of the day, we're all people who deserve to live, and we shouldn't have to fight and just not be able to have the ability to live because we can't afford it or just resources aren't available. I think that's the saddest thing to see, is just that we lose a life when the simple things that could have maybe been solved just aren't there for them.
Absolutely. And kind of just mirroring all of that, I think, we need to consider healthcare access and quality a basic human right, and kind of recognize when we're utilizing social constructs as kind of a basis for creating differences between groups of people. And I think, especially when we're talking about policy making, there should be a big focus on public health, which is something that can really impact entire communities. For example, COVID, people wearing masks, distancing, that was people taking care of each other through these public health policies. And so I feel that if we kind of focus more energy on making policies that kind of can impact a large group of people at a time, we'll start making progress there.
I really want to thank you, ladies. You all are beautiful human beings, and the work that you've done and continue to do is going to make a difference in our community. I really appreciate you guys for joining me and doing this interview. I want to thank you for sharing your valuable insight and expertise with us today. Healthcare access and quality is a critical component of the social determinants of health, especially in minority communities. So understanding these factors can empower us to advocate for change and work towards that to a more equitable health outcome. So to the audience, we want to thank you for joining us today on this edition of Wellness Wednesdays. We hope that this discussion has provided some useful information and inspiration to continue learning about the social determinants of health. Remember, education is power, and by addressing these non-medical factors, we can all contribute to a healthier, more inclusive society. So stay tuned for our next Wellness Wednesday session, where we will continue to explore important topics that impact our community. Until then, stay well and take care.